Now, a shocking video shows two doctors fighting inside an operation theatre in one of Jodhpur's biggest government hospitals, Umaid Hospital. They were meant to be conducting a caesarean of a high-risk pregnancy case. The child born to the woman died after the delivery. Doctors have been suspended from duty. The video was made by a staff member inside the operation theatre.
तमीज नहीं है, इसीलिए तो सर तमीज इसमें नहीं है, इसीलिए सर पे रिकॉर्ड करने आप पार्टी कह रही है कि इसकी एफिशिएंसी रेगुलर है और ये चेक करवा रहे हैं। तो क्या हो गया भाई, चेक कराओ तो क्या हो गया, नुकसान हो गया क्या?
मौत का सवाल है, इसमें कोई लापरवाही नहीं हुई क्योंकि मरीज के भर्ती होने के 3 घंटे के अंदर बच्चे का ऑपरेशन, मरीज़ का ऑपरेशन हो गया था। जितनी हमें एक समय लगता है ऑपरेशन की तैयारी करने में, मरीज़ के जो हमें प्रिलिमिनरी प्रिपरेशन करनी होती है, उतने समय पर पेशेंट को ओटी में शिफ्ट कर दिया था और ओटी में आने के बाद पेशेंट का सिजेरियन टाइमली हो गया था। बच्चे को निकालने पर सीवियर बर्थ एस्फिक्सिया और मेकोनियम एस्पिरेशन जिसे हम बोलते हैं वो था और बच्चे को रिवाइव नहीं कर सके। तो यहाँ पर इलाज में लापरवाही कोई नहीं।
And Harsha Kumari Singh is now joining us live for the very latest on this. Harsha, completely terrible what has happened there in that government hospital. We could actually hear both of them shouting. What exactly led to this altercation?
Well, that in fact is not very clear exactly what led to the altercation, and the hospital is also not giving out too many details. But it does seem to be that since this patient was an emergency case, she was brought in obviously without preparing her for a cesarean. So the gynecologist in question, Dr. Ashok Naniwal, he asked the anesthetist, or he asked somebody who was working with the anesthetist whether the patient had taken food or not, because obviously that becomes a concern when you are doing an operation. And that seems to have been the trigger. It also appears from the conversation that he was objecting to a young resident carrying out some tests, and he was not fully competent. So since there were 3-4 doctors there, of course the senior doctors were the anesthetist and the gynecologist who had that altercation, but there were other doctors and staff assisting them. So Dr. Ashok Naniwal appears to have had some questions, to which Dr. Tak, who is the anesthetist, responded very aggressively, and then this kind of an altercation broke out between them. And you can see that the staff are trying to tell them to calm down. Then, of course, in a follow-up, we have spoken to the superintendent. We've also spoken to the principal of the medical college. They've said that this kind of behavior is completely unacceptable and action will be taken against them. But they also said that the child, the fetus had a weak heartbeat, and that was probably the reason the cesarean had to be conducted, and the baby was born, survived for a little while after the cesarean, and then subsequently died.
Right, and Harsha, what exactly is usually the protocol for this between the gynecologist and the other senior doctors? Clearly, it seems that the doctor here, the main doctor, the gynecologist, had some valid questions, but the things certainly going out of control completely inside that operation theatre.
Yeah, well, certainly. Actually, it's the gynecologist, who's the senior doctor, who is really in control, because when he's doing the operation, the anesthetist's role really is, of course, to assist. That's very, very obvious. And if he had any kind of questions, they really could have been answered calmly. There was really no need to have this slanging match inside the operation theatre. So that clearly, I mean, the protocol there is very clear, because any operation that happens, the main operating doctor is the one who's doing the operation, whether it's a gynecologist or a cardiac surgeon or whatever. And the anesthetist's role is to maintain the patient's, to maintain that the patient remains unconscious through the operation, and to also monitor the patient's vital parameters.